At Back to Normal Physical Therapy, we offer a range of advanced techniques to help you manage pain and improve movement. One of these techniques is dry needling, a powerful tool for treating neuromusculoskeletal pain and movement impairments. Dry needling involves the insertion of thin, solid, sterile needles into the skin, targeting muscles, connective tissues, and myofascial trigger points. These needles help release tight spots, reduce pain, and improve your range of motion. The needles are strategically placed in or around areas of dysfunction or injury. When the needle hits a trigger point, a taut band of tissue within a larger muscle group, it can cause a local twitch response. This quick contraction reflex is both diagnostic and therapeutic, relieving muscle tension and improving blood flow to promote healing. Dry needling can be used for a variety of conditions, including chronic muscle pain, joint pain, sports injuries, headaches, migraines, neck pain, low back pain, and sciatica. What does it feel like, you ask? You might feel a slight prick as the needle goes in, followed by a brief muscle twitch or a sensation similar to a muscle cramp. This might feel uncomfortable for a few seconds, and some clients describe a deep burn or ache. Post-needling soreness, similar to the feeling after a workout, is common and usually lasts 24 to 48 hours. Is it safe? Yes. Dry needling is safe when performed by a trained physical therapist. The needles are very fine and sterile and minimizing the risk of infection or injury. While some clients may experience mild soreness or bruising afterward, these effects typically resolve within a day or two. The benefits of dry needling include relieving pain, reducing muscle tension, improving range of motion, and accelerating the healing process. The microtrauma caused by the needle encourages the body to release growth factors directly into the injury site, promoting advanced cellular healing.